All right, welcome, Jason.
Hi there.
So, a couple of questions I have for you that people might be wondering about, or some recent changes.
hmm
Um, and just to keep in mind, all that are listening, that this is a very fluid situation, so we'll give you the information as we know it right now, and some of that could change in the near future, and then we will let you know when that changes or if it changes.
Right.
So, first thing, if you could speak to some of the changes that we're seeing in the cafeteria.
A lot of you probably noticed there's going to be some signs up that we're not going to be able to self-serve things. That's probably a big change. There's tables that don't have chairs. Big change there. Really, what we want to eliminate is people touching surfaces that can contaminate them for the next person. So, does that answer your?
Yes, so getting rid of self-serve coffee
Mhm.
and water, and what are the options that we're putting in place of that?
I believe there is water available for a quarter, from what I have heard. There's some sodas in there. They've increased some of the juices and all of the other options.
And then I think we have coffee set up by the registers that the cashiers
Yes.
can pour for
Yes.
patrons.
Yeah, we just don't want people touching things. So we're gonna give you options that doesn't have to happen.
Okay.
So which will change.
Mhm. And what about reusable cups for our staff or anyone that's coming up to the coffee shop? Can you give some guidance on that?
No. No, we're gonna make sure that you're using only the stuff that you can use once and toss. So
Okay.
don't bring your cups.
Okay.
Again, they're dirty. Not that you're dirty, but your cups are dirty.
All right. Can you speak to a little bit of some of the recent employee health guidelines that came out regarding maybe people returning from travel or people that think they've had an exposure to COVID-19 as far as our employees?
Yeah. Really, the direction being given right now is managers and supervisors are the first person that you're going to contact. So, say you travel to Florida or to California or someplace that's a high risk state. I think there's 4 or 5 of them right now. You're going to want to let us know that. And then we're going to get you in touch with employee health. And then they're going to call you and maybe ask you some questions. But really, that's really all it is. If you're not showing any symptoms, what they're asking for you to do is wear a mask and monitor your temps. So same thing if you're sick but you don't have a high fever, and high fever is defined as 100 or higher, they're asking that you just put a mask on and then you monitor it. And as soon as that temp spikes, that's their first sign that they're going to want to do anything differently. So check with Rich and Roseanne, myself, Donna, find a leader, and we can guide you if you have questions about any of that. But really, those are the key things that we're doing right now that are a little different.
Okay. I'm going to jump ahead in the question list because I think this one kind of dovetails off of that. Can you speak to a little bit about our duty to serve in healthcare and what that means in this type of situation?
Yeah, I mean, it's really easy for us to panic. It's human nature to kind of get scared, and then think, I work in healthcare. I don't want to get sick. I don't want my mom to get sick. I don't want my grandpa to get sick. I don't want my relatives, my kids, so on and so forth to get sick. Working in healthcare, all of us have special training. That includes food service, EDS, all of our support departments all have special training. That duty to serve means you've signed up for this. This is what we're all here for. And there is a policy that SSM has out that says that we all have that duty to serve patients in a crisis, and that's what we're in. Kind of a pandemic, global, however you want to label this. What I've been telling everybody that I've talked to is have a healthy respect for it, but there's no need to panic. Relatively speaking, especially in food services, you're nearly guaranteed not to catch something if you're doing things the right way. So, and we'll talk more about that. I think that's one of the questions.
Mm-hmm.
We're going to be talking about PPE, but that what we want to avoid is people coming up to Roseanne and Rich and any of the other leaders here and saying, I'm not going to do that because I don't want to get sick or I don't want to bring that home. We can't really do that. Without you, the place doesn't run. The patients need meals in order to heal and get over not just COVID. I mean, you can think of the tons of things that are here. C. diff. I mean, none of those things you want to bring home. So we're assaulted daily by germs. We don't want people saying, no, we're not gonna help grandma in room 219 because she has something that I don't want to bring home. Well, if we're doing what we can to help grandma, there's no danger to you. So we all have a duty to serve. We're here, and there is a policy that does it's got some pretty strong language that says if you say no, there can be some disciplinary action. So I'd advise you to don't say no and come and talk to us. You can certainly come talk to me and I can help you to understand what you need to do. Donna's always available. Rich and Roseanne are great resources as well. So talk to us before you get to that point of I don't want to do it.
So Jason, you mentioned that our risk is very low, even though we work in a hospital, healthcare facility, where we might perceive that our risk is higher than maybe the average person in the community. Can you explain why that is from the perspective of the proper PPE that we should be wearing and how that makes our risk low?
Yeah. Think about how, and it's probably not something that the average person thinks about. I'm kind of weird.
It's true.
It is. The way diseases get in our body, there are very few routes of transmission, if you will. For this virus, it's really right here. So, not my face, but your face. Keeping your hands out of the mucous membranes is really important. So that's why we want to always have clean hands. So let's say you're working at the dish machine. A couple things that you're going to want to have on, obviously, you want to have gloves on. Why? Because if you have broken skin on your hands, that's another way a virus can get in you, right? We're going to avoid cross-contamination. We're going to protect our hands. That way when we taking the stuff off the trays, we're getting junk on the gloves, not on your hands. Take the gloves off, wash your hands. If you accidentally touch your face, you're still safe. Wearing an apron keeps it off your clothes. You might get a splash of food that somebody had eaten. Let's say, we'll just use COVID-19 since it's here. They had eaten off that tray, they left some food. There's now food on that tray you're scraping off. Let's say some of that splashes on your clothes. Chances are that you have gotten an exposure to COVID-19. It's very minimal. But still, why take the chance? Have an apron on. If you need to. Sorry, I got distracted, looked out the window and saw Rich's face. So, I forgot what I was saying. Wear the stuff that you're supposed to wear in there. So if the standard practice is always bad, wearing gloves, wearing glasses, wearing gowns, do that. If it hasn't been, then we're asking you to step up the PPE to wearing those things. You want to avoid getting things in here. So if you're at the dish room, by all means, put that stuff on. If it makes you comfortable, put it on. But there are some things that you have to put on. If you're taking trays up to a patient, get up there. You get up. Rich is making faces at me. So and I'm a child, so I have to react to that. So you get up to the room, up to a patient room. It says droplet precautions. What do? Read the sign. You do what it tells you to do. Now this stuff changes. It's very fluid. So when COVID-19 first came in, it was airborne precautions, which means we had to do a few things differently. Now it's droplet. So imagine what droplet is talking about. So we're talking about a patient who can cough and expel the virus, right? How can it get on you? How close do you have to be? The kind of the rule of thumb is 4 to 6 feet around a person is sort of that realm of spreading. That's my definition. That's not the medical term. You can get coughed in your face if you're putting a tray down um, in a room. So what listener, viewer, what do you think you should do in those cases? Okay, we want to make sure we have our PPE that we're going to prepare for this. So gown, glove,
Mask.
right? Now, there's been some debate over eye protection. So a new thing came today where we were challenged that food service needs to wear eye protection in there. Now, I wear glasses, so my eyes pretty much are always kind of protected. Yours may not be. Is it okay if you put glasses on? Certainly. They're talking about putting PPE stations outside the rooms, so there'll be some available. Now, I'm waiting on confirmation on whether you have to wear it. So that's kind of where we are in this fluid. Like, things are going to change, and also depending on where you are. So, if you're delivering a tray somewhere where it's really high risk, where it says airborne precautions, then it's a little different. Then you don't need the eye protection because we're not talking about something that's transmitted via. I keep doing that. By that I mean spray out of the mouth or nose. Somebody sneezes or coughs at you. That changes the transmission. So those two different terms, airborne and droplet. Droplet is talking about the heavy mucousy kind of things. And airborne, you can just breathe it in and get it. So there's the difference.
And we would not be delivering to airborne precaution rooms
Right.
in food service.
Right, you're not going to. You may see those signs, and that's going to tell you don't go in there because you shouldn't. You don't have the proper level of protection on. Droplets we can deliver to because again, it's the heavier, it's the stuff that's going to, a sneeze and a cough. How far does that go? It doesn't go very far. If you sneeze more than 6 feet, you're a superhero. So just be comfortable and protect yourself. I'm responsible for the EVS team as well, and I'm telling them the same thing. If you want to wear something and if you feel better about it, do that. There's nothing wrong with it until we run out of resources, and then it's going to be the doctors and nurses that are going to get that first. So the people that just want to wear it won't.
So, can you speak to what is going on 6 South right now? As a food service worker, should I be afraid to go into 6 South?
Absolutely not. So, for one thing, just walking through there is zero danger because each of those rooms is now converted to negative pressure, which means the air flows in and not out. So the air is not coming out into the hallway. So just walking through, you're perfectly fine. So what if you're delivering a tray? Okay. Again, not every patient on 6th floor has COVID-19. We have 3 in the hospital. There were 4 yesterday, but unfortunately one of the patients is no longer with us. But that's 3 patients, and one of them isn't even on that floor. So that's really 2 on that floor. And I believe it might even be 1 because I think 1 is in ICU yet. So, just because it's dedicated, it's for any airborne, any droplet precautions that we're bringing into the hospital, just so they're all in the same place and can share resources. So it could be any number of respiratory disease, bronchitis, anything like that. They're putting there. So it's not just COVID patients. So no reason to worry at all. Again, if you're protecting yourself, you're nearly 100% safe.
Great. Sounds like you are getting called. Do you need to answer that?
No.
Okay. Can you speak to any recent system or St. Agnes communications that have gone out? Any need to know information from there within the last day or 2 that you want to share with the group?
So I think there's been a couple. I'm just going to duck down.
Sure.
I brought some notes. My most recent one, really, and this one talks just mostly about travel. Anything in specific that you have in mind that you've heard?
Maybe are there any services that we know that are closing, or any changes as a whole for visitor restrictions or different things that employees would need to know when they're coming into work?
Yeah, so far with COVID-19 and